Hello and welcome to Pitt Resource Connection television show. My name is Cindy Asbell with Rural Crisis Intervention here in Greenville, North Carolina. I had the pleasure of interviewing Kimberly Williams with Trillium Health Resources. She's a training coordinator with them, and I'm looking forward to hearing information about Trillium from you today.
Thank you. Excited to be here to share that information with you.
Wonderful. So, who are the community liaisons at Trillium?
So the community liaisons are coordinators that live in the region that they serve. So they generally serve about 5 to 6 counties and they live within that region. As you know, Trillium covers 28 counties, so we have a large area. You know, the value of that is they know what the community needs. And so that's their job, is to, they attend meetings, they participate with DSS, the local schools, law enforcement, and try to get really enmeshed in the community to find out what's needed and take that back to Trillium so we can better serve the community.
So when that liaison is attending those community meetings, what is their role?
So the first role and most important role is to be a good listener. So they're there to pick up and listen to what the community is saying they need, what their strengths, maybe their weaknesses are, what they need, take it back to Trillium and provide, hopefully we can provide services that would meet those needs. And of course they also share what services Trillium currently has and how to access those services.
So if a stakeholder group wants to have a presentation, is that going to be done with a community liaison?
Yes, absolutely. So they can go out and share that information. It can be done with faith groups, child care organizations, elder groups, anyone that's interested and needs information about services and how to access those services with Trillium. The community liaison can do that for them.
So Trillium Health Resources has a huge the umbrella of so many different services. So can you tell me a little more about what they do?
So Trillium is a local governmental agency. You may hear us referred to as the LME/MCO, LME standing for Local Management Entity, MCO Managed Care Organization. And we manage the mental health, substance use, and IDD services in 28 counties in eastern North Carolina.
Oh, wow.
Yeah, it's quite a task.
That is quite the task. What are some other ways that you all work in the communities?
So we have our training department. We offer mental health first aid. So that would be older adult. We do adult, youth, older adult, veterans, and we have started with tribal communities. And we provide mental health first aid, which is an 8-hour course. We also provide QPR, which is Question, Persuade, Refer. It is a suicide prevention program. QPR, mental health first aid, can both be virtual or we can do face-to-face, whatever is needed by the individual requesting the training. I'll also say that mental health first aid, you can go on the Trillium website, trilliumhealthresources.org, and we offer a youth and an adult training virtually every month, and you could sign up for that on the website. We also provide CIT, Crisis Intervention Team Training, which is to first responders, as you're aware. We've talked about this. It's a wonderful program. It's a jail diversion program, and basically we're going in, it's a week-long program that our first responders attend, and they learn all about signs and symptoms, how to de-escalate, verbal de-escalation. They learn about suicide. It's a wonderful program to get individuals who may be experiencing a mental health or substance use crisis or challenge the resources that they need. We are also going to be offering CCI, Community Crisis Intervention. It's going to be through our the Learning Campus. It's our learning management system. It's going to be through the Learning Campus. It's going to be 100% online, self-paced. There's no charge for any of our trainings. There is no charge. But again, you just would need to log on to My Learning Campus under the trilliumhealthresources.org.
And that's very well, I've been on the website before. It's very easy to navigate through the website, looking at resources, looking for the trainings and all those types of things on there. So that's good to know that. Great. So I hear that Trillium has partnered to develop a new peer-run group. It's an organization or a program where people are struggling with their addiction and may experience homelessness as a part of the efforts to address the health disparities in eastern North Carolina. The program is called The Healing Place, is that correct?
Yes.
So what can you tell me about The Healing Place?
We are so so excited about the opening of the Healing Place. It's in Wilmington, and the grand opening is actually tomorrow.
Oh, wow.
And it is a wonderful opportunity. Trillium has partnered with several agencies in the community. It is a place for people who may be experiencing addiction can get help. It's a peer-driven social model. There's going to be 100 beds for men and 100 beds for women. Much needed beds.
Definitely.
For individuals experiencing addiction. There is no cost. If you live in our 28 counties, and you can, like I said, you can go to the Trillium Health Resources website, and we have those counties listed. If you live in our counties, you can get treatment. So we are really excited about this program, and the grand opening is tomorrow. It is in Wilmington. There's several across the U.S. There is one in Raleigh that's been there for quite some time.
That's great. With that the healing place, that's my understanding that it's not a one and done. There's multiple opportunities to keep trying to be able to present again each time to try to push through. If you fail, it's not a you can never come back again kind of a thing. It's we're going to be here when you're ready to try again.
Right. And part of addiction is a complex need, and part of recovery is relapse. Most people who are experiencing addiction don't say, okay, I'm just going to quit, and they quit and that's it.
Right.
It takes time. It's a journey.
Definitely.
It's a real journey for people. So the thing about the Healing Place is they have that opportunity to go in and out if they need to get through that journey.
That's great.
And it's peer driven, so they have peers there to support them.
Well, that's really important that it is peer driven, because that gives them the opportunity to see someone else who came out on the other side. And if they can do it, that can give them hope that they too can push through.
Absolutely.
That's great. Now, Trillium has done decades of work focusing on creating the health equity for people in our area who have IDD, intellectual developmental disabilities, autism, and TBI, or traumatic brain injuries. I know one of the areas that's provided a much needed resource for children in the summer are the summer day camps that Trillium is sponsoring with the Autism Society and with Easter Seals.
Yes.
Tell us more about that.
Well, so Trillium has partnered with the Autism Society and Easter Seals. They provide a year-long after-school program for children, as well as a summer camp for children who are experiencing, who may have an intellectual or developmental disability, autism, or who may have a traumatic brain injury. They just need to go to the Trillium website and they can find out more information. Call Trillium 877-685-2415 and talk with a coordinator and get information as to how to apply to those programs.
Now, you people at Trillium are very innovative about things and systems today. Tell me more of one of your most innovative programs.
That's one of the things I love about Trillium is we are always thinking outside the box for our members. What can we do to help them? And Timmy was one of the options that we had. Timmy is a robot. Timmy stands about 3.5 feet tall. He doesn't have arms, but he does roll. He is mobile. And we selected several members within the community that we thought would be a good fit. We actually launched this program before the pandemic.
Okay.
Yeah, so it was really, the timing was actually good. We launched it before the pandemic, and Timmy is a robot that he has Alexa capabilities. So you can tell Timmy commands, Timmy, turn on the lights, and if you have the system, he turns on the lights. He does medication reminders, FaceTime. It's a larger screen, so he can do FaceTime. So that was one of the things that enabled individuals, they could communicate with friends and family during the pandemic, and he's mobile. So for people who have mobility issues, you could say, hey Timmy, go to the living room, if Timmy's hooked up to his charging station in the kitchen, and Timmy will roll to you in the living room, and you can interact with Timmy from that. One of the other things about Timmy that he does is it's connected to your phone. So say you were an individual that had anxiety and you left the house and you're so worried, is the cat okay? So through your phone, you can connect with Timmy and operate Timmy, and he can roam around your house and find your cat.
Oh, wow.
and you can see the cat. Oh, okay, it's okay. So, and you can go about your business. So he has those capabilities. Wow. Yeah.
Sounds like he does everything but bring you coffee.
He doesn't make the coffee, but if someone can put it on his tray, he can bring it to you.
Okay. All right. Timmy and I might have to talk. That sounds fantastic. That's great. Oh, I love the innovation for that. Okay, so switching gears a little bit. We've all heard about opioid addiction and how we're at the epidemic level. Tell us some of the things that Trillium is doing to address that.
They're doing a lot of things, and again, access the webpage and you can find out more. But one of the things that they did is they partnered with stakeholders. We had $1 million in funding, and we were able to give free Narcan to certain stakeholders, which it helps to reverse an opioid overdose. Can save a life.
Oh, wow.
And that's what it's about, saving a life. So we were able to partner with stakeholders and provide those to save lives.
Oh, wow. Goodness. So many things you guys do, so many things.
Yes.
So is there anything that we haven't talked about today with Trillium that you want to tell us about that would maybe highlight how the health equity is being improved in our area?
One of the things that I do want to mention is the Child First program. Trillium's been doing this for a decade.
Okay.
And it is a birth to 5 year program for children birth to 5 years and their caregivers. It's based in home. So we have individuals that go to the home and find out the needs and help overcome those barriers that people may be having for reaching services, such as transportation. So we would assist them with whatever their needs are to get people to the appointments. And you know, a lot of times people don't know what's available until it's told. They don't know what to ask. What they need things. So that coordinator in the home can manage those things. And through that program, we are very, very proud to say that Trillium has the lowest number of children in out-of-home placement in the state.
Oh, wow.
And right now that is a huge issue that's going on.
Definitely.
We're having a hard time placing kids out of home. Trillium has those lowest numbers, in part due to programs like this.
Great. That's amazing that can be helped. Having somebody that can advocate with you, that can be with you, cut through the red tape, let you know what's out there. Just having that person there.
Right. And when they're there, they can see what your needs are. You know, sometimes we don't know what we need. We just know we're struggling.
Right.
And sometimes having someone there can help you identify those needs.
That's fantastic.
Yes.
Wow, lots and lots of things you all do.
Yes,
I think one of the best
excited.
things we can say is go to the website.
TrilliumHealthResources.org, or you can call the Access to Care line, 877-685-2415, and we have coordinators there 24/7. They can answer your questions.
Great. Well, I really appreciate you coming in, Kimberly, and
Thank
telling us
you.
all the so many things that you guys do.
Thank you.
And so much of a positive contribution, making changes, you know, guiding people, supporting people, coordination.
Yes, I'm just so excited. Trillium is really reaching out to the community. We've made strong efforts to reach out to the community. We're really focused on health equity and community inclusion. And one of the things again that I mentioned earlier is we think outside the box. What can we do to be helpful?
Yeah, and not saying cookie cutter, this is your plan, this is your plan. What works for this person, person-centered, individualized,
Absolutely.
and not forcing something that's gonna, you don't want to set people up to fail, you want to set people up to succeed.
Right.
And what does that look like for them?
Exactly.
Great. All right, well, I think we've covered about everything I
you.
can think of possibly. I really appreciate you coming in.
Thank you.
It's been great to have you here with us and to be able to share your information, and love when people come in, learning new things. We're able to share that with our communities, and hopefully that information is stuff that they will be able to reach out to in order to be able to support either themselves or other people.
Absolutely. Thank you for having us.
Great. Thank you so much for coming in.
All right.
Thank you all for joining us today for Pitt Resource Connection Television Show. My name is Cindy Asbell. Take care. Have a great day.